Thank you, Wayne, so much for that introduction. And, just to pay homage to the trucker movement, I thought I would do this from inside of a car. It seems like ranting inside of a car is what's the most common thing these days to show that you're average of the people kind of person. And I'm so average that because I couldn't be with you tonight in Winnipeg, I am coming from you outside of where I'm about to play soccer. We start playoffs. I believe we start playoffs tonight, and so with COVID, I had to do both. So you also get a rare look at me in my soccer kind of look, although my hair is not tied back yet. We can talk about soccer if you'd like. It is one of my favorite subjects, which I do not write about. But I suspect that most people are here tonight to hear a little bit about why I wrote Spin Doctors, what the book is about, how it came to be. And a lot of you may have had the chance, maybe not have had the chance to see the book that I just previously written, Take Back the Fight, which is a book on feminism in the digital age. And during the pandemic, to launch one book during the pandemic is I really suggest strongly against doing that. 2 books during the pandemic, it's a bad idea because you don't get the chance to actually exchange with people for the ideas that you have. And so that can be really difficult. But, we'll do our best with being virtually and hopefully, while Wayne said I'll talk for 30 minutes, I think I'll probably cut that a little bit because there's so much to talk about in this book that I suspect the questions are going to bring us to different places. But to start, I think it's important to just mention how this whole thing happened. I started to do daily data collection, as many of you will know by now, one of the few people in Canada, and then eventually became the only person in Canada, collecting daily death related statistics to outbreaks of COVID-19. And in doing this research, I had to read so much. I read between 30 and 50 articles every night to try and construct this list. And the most recent update I did to this list was 2 nights ago, and I believe it's at about 20,700 deaths. That's 20,470 deaths about. I mean, this is by memory, of deaths related to long-term care, residential care, hospitals, prisons, and shelters, group homes. The data that we can get, which a lot of times it's actually not at all available, and related to outbreaks at the work site. Canada has such a poor data regime, such poor data collection, that if it wasn't for my just nightly research, we would literally have no idea how many people have died in Canada as a result of COVID that they caught on the workplace. And while my number's low, it's at least 250 people have died of COVID on the workplace. Now, to put that into context, if you look at the United Kingdom, where the Office of National Statistics had actually collected the information of people who died from COVID in the working years, so the age of 20 to 65, they looked at where those people worked. So not necessarily that they got COVID on the job, but unsurprisingly, the people that were more likely to die were working in precarious, low-income jobs. They were more likely to be racialized. They were more likely to be poor. And we can't say the same thing with much certainty in Canada with the official data, because unlike the data collected by the Office of National Statistics in the UK, we don't have anything. And so through the research that I've done, what we can say for sure is that this has disproportionately impacted workers who are not white. If you look at the data related to workers in healthcare, where we do have the best data because healthcare unions made this into, made issues every time one of their workers died, or there were announcements made by government or whatever, we know that that almost half of the workers that died were Black. Okay, and so that's not just the majority. And if folks joining can mute, that would be super awesome. Thank you. And so that's not just the majority, but it's because if you then add all of the other racialized workers into this, the number climbs to 75%. And so all of a sudden we have this crisis of COVID that has a racial dynamic, that has a class dynamic, and then of course has a disability dynamic. And disability, rather than being talked about as disability, it gets remixed in this pandemic as being comorbidity. Do you have something that would make you more susceptible to dying from COVID, rather than understanding this as as something that travels through networks and through communities. You know, I've been following Manitoba very closely. I mean, I've been following the whole country very closely. And Manitoba is interesting because it's the province now, this was not always the case, but it's the province that gives us the best death data related to outbreaks. And so every day we get non-cumulative numbers, so I have to count them whenever I catch them, of who has died where in relation to an outbreak. And unlike the rest of Canada, the data includes hospitals, which is really, really important because we don't actually know how many people have died in Canada as a result of COVID that got in a hospital. We know that as of August 2021, that number was it was at least 1,600 and has obviously increased since then. That's a whole other thing that I'm waiting to get more data on, and I hope to be able to share those numbers with you soon. So in collecting this data every single night, and I was finishing Take Back the Fight, my second book, I had this flash, and you know, shout out to Fernwood, obviously a mainstay publisher in the Winnipeg community. They agreed to my very quick proposal, saying, look, this moment is going to vanish. We're going to lose the record of the pandemic. Can I please write a book about COVID? And they said, sure, except on one condition. You have to, or can you, get this out by fall 2022. And so I put the proposal together in August 2020, and I had 6 months to write 75% of the book, and then I had another 2 months to finish the last 25%, get everything up to date. And what was produced is what you have. And so I target two different groups of people. I target politicians and I target journalists. I also talk about public health officials, but I don't talk about public health officials as much as I think a lot of people would probably wish I had. And we can maybe talk about that in the Q&A. I just saw one review where someone was critical that I didn't talk enough about public health officials and their complicity in all of this. And I think it's a fair criticism, although it's one of those things that in 2020, the failures of the public health officials was not as obvious as today, when public health officials are like, oh yeah, COVID's over, you're fine, we don't have to track anything. You know, things have really changed quite a lot since I handed in the manuscript in on August 2nd, 2021 or whatever it was. But politicians, I think it's very easy to see how politicians have failed us, and we have no shortage of examples of this. Manitoba has no shortage of examples of this, and as you know very well, you started this pandemic with someone who thought that he could grandfather himself out of this pandemic by scolding the population, by passing off, blaming people for partying or for gathering, rather than doing what was necessary, which was actually giving people the tools to stay home, give people paid sick days, give people what they need to quarantine, right? Make this actually a little bit easier for us, and instead just let it run roughshod. But you know, Pallister, and now I want to say Heather Robinson, but I don't even know if that's who it is, because I know there's a fight. I have to say, the whole Manitoba political scene in the last couple of months, I've been a little bit less paying attention to. But the conservative regime in Manitoba is not much different than the conservative regime. Thank you, Stevenson. There you go. Heather Stevenson or Stevenson, right? It's not much different than the Moe regime, obviously, than the Kenney regime, but it's also not much different than the Horgan regime. And so here we are in Canada. We've got a liberal government federally. We have an NDP government in British Columbia. We have conservative governments from Alberta to I guess the rest of Canada, except in Newfoundland, Labrador, and I'm not even sure at this point if that's right anymore. My goodness. And all colors, all parties were doing the same thing. They were all treating this as if it was an individualized responsibility, that we had in our own power the ability to keep ourselves safe. And if we didn't keep ourselves safe, it was a personal failure, right? It was something that we should have been able to keep ourselves safe, and we didn't. The way that changed our relationship with one another was that it obliterated our understanding of community. And so one really good example of this is in schools. So schools were never talked about as places where Students have networks through their parents and their parents' workplaces, and then you might see a cluster in this workplace that'll find itself in this school because the parents and the children all work in these, like, live in this kind of milieu. There's no discussion of the connection between children and long-term care facilities. There's no connection between long-term care facilities and meatpacking facilities when we're talking about precarious workers or refugee workers who are having to cobble together a livelihood from location to location. These analyses, I mean, they pop up from time to time, but by and large, they're absent from the conversation. And just as I was putting the proposal together for this book, as I said, it was August 2020. And so, you know, hopefully you all go right to August 2020 and know exactly where was the hotspot in Manitoba at that point. It was in Brandon, right? It was at the Maple Leaf factory. And that outbreak was, the whistle was blown on it early, like when there was a couple dozen cases, and it was blown by migrant rights organizations working with the workers themselves, saying, we have a problem here, there's an outbreak. And public health from Winnipeg says it's not related to the workplace. It's related to other factors. These people who work there, they live together, they travel together to work. That's where it's spreading. And so this happens at 40 cases. This happens again at 60 cases. People are demanding louder, shut down the factory, shut down the factory. And Maple Leaf is a national chain, right? It's a national company. And they were shut down in other parts of Canada when they had big outbreaks. But in Manitoba, it was like, this is not a big deal. This is not happening in the plant. The outbreak gets up to 93 cases by September. And, you know, we're talking about the largest private sector employer in Brandon. And you go to the Brandon Sun and it's barely in the newspaper. The Winnipeg Free Press writes about it. The Brandon Sun writes a little bit about it. And it's like, what is going on? Why is this not getting the coverage that it needs? Is it because these workers are precarious? They lack status in a lot of cases, or they're temporary foreign workers? Is it because they're not white? Like, it's all of these reasons. It's all of these reasons. And it gets replicated across other industries, other meatpacking facilities, other provinces, because the problems that were laid bare by this pandemic were systemic. And the systemic issues that all of us on the left are always banging our drums about and complaining about and saying, we have to change this or we have to change that. You know, long-term care is dangerous. The healthcare system is going to collapse. Precarious work is causing harm. All of these things come to a head in this pandemic. They come to a head because the pandemic, COVID, exploits and then exaggerates the class and the racial dynamics of society. And that's a riff off of a quote from Jean-Paul Sartre, who I quote at the start of this book, right? Saying that that pandemic, and he's talking about a different pandemic, but pandemics are an exaggeration of social relations. They exploit the social relations, the social structures that we have. And so the story with Brandon, it's a failure of politics, of politicians, it's a failure of public health, but it's also a very big failure of journalists. And so that's the second part of this story, is how media failed to capture what was happening and then giving people the same messages over and over so that they can try and figure it out themselves, how to save themselves or fix things or wash their hands for 20 seconds or sing happy birthday while they're washing their hands or whatever. And journalists are in this double bind where they are crushed by what the pandemic brings in terms of the economic reality of a lot of newspapers having to close. You know, 3,000 journalism jobs lost in Canada over the course of the pandemic, like just stunning numbers. And they're all then also working under very difficult conditions, very difficult circumstances. They are working from home for the first time. They're working with kids, bothering them, trying to do childcare and journalism at the same time, right? And then that comes through their stories, which is, I think, my big theory about why childcare is in the news so much is because so many journalists have children. And so that came through, which is also why a lot of confusion existed around low income and precarious work, because a lot of journalists do not have those kinds of direct connections with people working in low income and in precarious work situations. And so we have the first scribes of history repeating the lines of public health verbatim and calling it journalism and being like not like hostile sometimes, or standoffish, or not pushing enough to be able to talk about the issues in the way that they needed to be talked about. And instead they were relegated to investigations, right? They're relegated to a couple of journalists who have the skills to do deep investigations that happen from time to time, right? And it's inadequate. It's not enough. And the stories that we get do not tell the whole picture. And so what happens is that you get this weird situation where there's a worker dies in Winnipeg, or a worker dies in the Battlefords, a worker dies in Calgary. And the way journalists talk about it is, the first person has died from the province of Saskatchewan. The fourth worker has died in the province of Manitoba, right? In Ontario, the 27th worker has died. And then they don't even say in the province of Ontario. There's no national picture to anything that's happening. And that's because journalism reflects federalism, that the national journalists are in Ottawa, and if it doesn't relate to Justin Trudeau, then there's no national picture. And so for 2 years, we have no idea where's the hotspot every week, where are things on fire. Everybody thinks that they're always in the worst of it. There's always this moment of, oh my God, cases in Regina are on fire. It's like, oh, you think Regina is bad, Whistler is on fire. It's like, oh, you think Whistler's bad, Sudbury is on fire. And it's just like, there's no national storytelling that brings this all together to allow average people to see how Canada as a whole is interacting with this pandemic. Very few comparisons. When I was part of a group of people that wrote a report on excess deaths, how many people probably died unofficially versus the official numbers. And in that comparison, we found that provinces were doing completely different things when it came to tracking deaths and tracking how many people probably died from COVID. So you have Quebec, where every death of someone who is 85 years of age or older that was in excess of what was expected based on data from the year before was considered a COVID death. When you go to British Columbia and do the same calculation, 0 deaths in excess of what was anticipated of people 85 years of age and older were considered COVID deaths. Like then you start comparing apples and oranges. It's just very, very difficult to get a true national picture of what's going on. And when this was given to Bonnie Henry in British Columbia, she said, well, this is a report that's based on Ontario data. I'm taking it with a grain of salt. And it was like, that's a very bad response. So journalists, though, were not prepared to understand epidemiology, pandemics, how to report about pandemics when the stakes were so high. And so what we get is a lot of confusion and reliance on the official line. And so I cover all of this in the book, and I do want to hear people's questions about this. I'm not going to continue too much longer. But what is so interesting today is that now that testing has collapsed, that we're not reporting numbers anymore the way that we were, journalists are going, oh my God, we don't know what's going on. And it's for me, it's very frustrating, because it's like, you've been relying on the official line. And now that the official line is the pandemic is over and you're not getting any more official information, journalists are so ill-equipped to be able to say, okay, well, we've actually built our own databases. We've actually got our own measures. We know that, this is the ratio between intensive care units and hospitalizations and deaths. And we can make a extrapolative estimate on how much COVID's probably in the community. There's no journalists that are able to do that, because no one approached this data deficit in the way that I did, which was to say, okay, we got to do what we can, because the second that people in power want us to forget about this pandemic, they're going to erase this data. They're going to make it hard for us to see. They're going to act like every single wave is the first thing that we've ever experienced ever. And it's going to be harder and harder to remember what September 2021 looked like, what June 2021 looked like, what April 2021 looked like, and then, I mean, all of 2020, it's like completely theoretical, right? But someone asked me, like, how do you think your book stood up? Like, rereading your book now, how do you think it stands up? And I say, you don't reread your own book. Like, I don't know. I don't know. So that would be up to folks in the room who have had a chance to read it, and who might have any questions. But the most important thing for me was getting a record of what happened. At the start of this pandemic, there were a lot of interesting conversations about the Spanish flu. And why was there no common knowledge about the Spanish flu? This was this massive pandemic that killed so many Canadians, killed so many people in the world. And for me personally, I knew about the Spanish flu because my great grandfather's first wife died from it. And this was a story we knew because my great aunt, my great uncle had different parents than my grandma, right? And so this was something I knew because of the Spanish flu. She died. They all got it in Northern Ontario in Timmins. And to see how little common knowledge remained in society from that moment, to the point where articles are like, did you know they made masks in 1920? Like, oh wow, that's so crazy, we're making masks today, right? In this period of time that we do have memory of, I mean, Winnipeggers have a lot of memory of 1919, and we have memories of World War One. How was it that there's no collective memory of what happened in that pandemic? And I'm gonna end there because I know there's gonna be a lot of questions, and my teammates probably gonna get out of the car. It's gonna be a bit of noise. It's gonna be no problem. But this lack of record, this treating us all as goldfish, always recreating this narrative as if we've never experienced any of this yet already, for me was the big indicator that this data will be erased the second that those in power want it to be erased. And so I hope that in writing Spin Doctors, I've created at least a first draft of what's happened. And I do look forward to people building on this first draft, not me, to refine it and to continue the story. Because as I wrote it, I really thought that this would be over sooner than, of course, it's not over.
All right.